great. We're good.
Hello, everyone. Welcome to the NJ Spine and Wellness live stream here on Instagram and Facebook. I'm Chris Robinson, social media manager here at NJ Spine, and with me tonight, I have Dr. Saymeh.
What's up, guys?
Probably can't see him yet. I'll leave him a little bit. There you go.
Hey, y'all.
Dr. Brian Acquaro.
Hey, guys.
We are broadcasting live from NJ Spine and Wellness in our Freehold location, and tonight's broadcast is going to be about preventing foot and ankle pain in the workplace. We'll get into that in just a minute. First of all, how are you guys doing?
Doing well.
You just got back from vacation.
I did.
Where'd you go?
I went to Nantucket with the
fancy.
wife. Yeah, it was fun.
Wow, right.
It was nice. We only went for a couple days, but it was good to kind of get out a little bit and take some time off and decompress and come back more energized.
Jump right back in.
Yeah,
There you go.
absolutely.
Have you vacationed at all?
Not recently, unfortunately. I'm like Doc. I don't get away as much. But I try my best, you know.
Nothing to stuck
say.
here. Well,
Yeah.
that's good. So we're going to take some questions a little later on. We're going to let these two guys jump right into it and give you some tips. I mean, there's all sorts of jobs where you're on your feet all day. Some people are probably not wearing the right shoes. Some people are not, just taking care of themselves, and that's what causes a lot of foot pain. And then you come to these guys for the physical therapy, for the surgery at some point. So I'm going to hand it over to them. Like I said, leave some questions in the comment section, and let's rock and roll.
Nice.
Awesome.
Great. Yeah, so today, guys, we're going to talk a little bit about kind of our professions that are standing on their feet a lot. We wanted to focus a little bit on our teachers, our nurses, our police officers, anybody who's spending a lot of time on their feet, which really nowadays is a lot of different jobs. A lot of things that come with that tend to be different foot pathology, different injuries that we see very frequently, and these are common complaints we get in our clinics, so we kind of wanted to go over a few of those. Doc, I don't know where you want to start.
I mean, we're standing on our feet in solidarity with that
Yes,
today,
yeah, that's what we're
right?
doing. This is for you guys, really.
Yeah.
So
I think the first and foremost, the most common foot and ankle pathology that we see with teachers, construction workers, police officers, everyone who's on their feet on those concrete floors constantly. The Amazon workers, we see a lot of that.
Oh my God, tons of that.
Is plantar fasciitis. Is that heel pain, that throbbing heel pain that they get? And I want to. We've talked about plantar fasciitis a lot, but I want to dive a little bit deeper into it and what the plantar fascial band actually is, and what it's doing, and why it's under so much stress after a long days of work. So, the plantar fascial band, there's actually three portions of the plantar fascial band. There's the medial band, the central band, and the lateral band. And the medial band is the most inner portion of your plantar fascia. So the plantar fascial ligament, being that it's consisted of those three bands, the most affected one is the medial band. And that's typically why you have the most pain on the inner portion of your heel. So as time goes on and you're in the workplace, really what plantar fasciitis comes down to is that it's an overuse injury. And an overuse injury with teachers, construction workers, cops is, they're constantly on their feet. They're standing for 10, 12 hours out of the day, and they're putting a heavy, heavy strain on their feet and on the plantar fascial ligament itself. So plantar fasciitis, a big, big topic that we have to discuss in order to help the majority of our people get better.
Let me jump in real quick. When should they come and see you guys then? They have plantar fasciitis, they're feeling foot pain. At what point, do they need to come see you guys?
So plantar fasciitis, when you have these symptoms, just to give you a quick breakdown of kind of what that's going to feel like, what that's going to look like, right, is typically what we say is when you get out of bed in the morning, you step down, that first step or two really is very painful in the heel area. It's typically just at the bottom of your foot, right where your heel is kind of in the front of there. That's where that plantar fascial band attaches. So that tends to be where you're going to feel the most irritation.
Sure.
As you're moving around throughout the day, it tends to feel a little bit better. However, if you start to stand on your feet for long periods of time, or you have improper footwear, you're barefoot, you're going to start to feel this pain again, and it's a very common injury. It's actually one of the most common injuries we see in physical therapy. So when you start to feel these symptoms, especially with something like plantar fasciitis, is that you really don't want to let it linger, because the longer it goes on, the more irritation that created in that band, and the longer it takes to get rid of that irritation in there. So general rule of thumb is when you start to feel this stuff, you want to consult somebody. You want to come in and see a doctor, come in and see a physical therapist, get your foot checked out, get your footwear checked out, and see if there's something going on at that point. If you let it go on for 6 months, it's going to take a long time to heal it, because now you have a very chronic injury versus when it comes in, it's very acute in the beginning.
And what a lot of people actually don't know is that it's directly related to the calf muscle, right? Mm-hmm. So calf muscle is made up of the gastrocnemius and the soleus, and it comes together to form that Achilles tendon that we hear so much about. And that tightness on the plantar fascial band causes the plantar fascial band to really contract, especially at night. And that's why when you get up in the morning, that first step out of bed is the shocking pain. And then as the day goes on, it starts to get better and it relieves. But then you sit down again, and then that plantar fascial band again contracts, shortens, gets tight, and then it stretches out again. So that pain that you're experiencing really can be subsided with physical therapy, with stretching exercises, at-home stretching exercises. Come into the office, learn the stretching exercises to do. And typically, if you come in at an earlier stage, the less intervention that I have to do. Of course, more intervention for Dr. Bry, but it's definitely, there's going to be a lot less work from a steroid injection standpoint. But we got to get you into custom molded orthotics. With support of that plantar fascial band with the arch.
100%. And that's really the key, is that if you come in early and you get in there within the first few weeks of having an injury like that, it's very easy for us to rehab it, because we could do manual therapy on there, we could do a lot of stretching, we could teach you a lot of things. The tendon is still kind of where you want it to be, the fascial band is still where you want it to be. As that starts to be stuck in that contracted position longer and longer, and it's irritated and it's flared up, it's going to start to degrade the actual fascial tissue. And that's when you start to look at possibly having to do cortisone injections or some other procedures that Doc can talk about as well.
So
let me jump in.
Yeah, absolutely.
Sorry. So the custom orthotics, I was actually with you today, and I saw that you gave them to one of your patients. I mean, if you look at the insoles that come with your standard shoes, it's just a flat piece of nothing. I mean, is custom orthotics, is that something people, I mean, if they know they're going to be on their feet all day, is that something they should come to you like right away for? Or?
I mean, absolutely. I mean, it's preventative medicine, right? That's what medicine is all about these days, and in the present and in the future, that's where we're headed, right? So it's to avoid injury in the future, and what orthotics do is it really creates a supportive environment for your foot, and not only for your foot, your ankles, your knees, your lower back. I can't tell you how many times that someone comes in with lower back pain and they're referred over to me because someone has maybe flat feet or a high arch, and it's causing this shift or imbalance in their gait, in the way that they walk. And we get them into orthotics, put them into a more neutral position, and that really helps everything up the chain and reduces pressure on the lower back. Custom orthotics is important to get into as a preventative way to stop the pain, not only in your feet and ankles, but your entire body.
Yeah, absolutely. Especially when you spend a lot of time on your feet. I try to explain this to people. If you do spend a lot of time on your feet, you probably experience this as being on a hard cement surface versus standing on a carpeted surface, or something that's maybe a little more cushioned, or standing barefoot versus standing with your shoes on. It makes a tremendous difference on your entire lower extremity, from your back, your hips, your knees, and everything else. That orthotic is going to give you more cushion, more padding, which is also going to help to increase that effect that you're getting. So you're going to feel a lot better on your feet with something like that.
Yeah, so I mean, we've talked a lot about the conservative aspect of plantar fasciitis and what you can do to prevent it, or maybe get it when it's in an acute phase or an early phase in plantar fasciitis. But the reality is that a lot of people wait until it gets a lot worse. So when they wait until it gets a lot worse, that's where I typically come in, and we have to do a little bit of an intervention in terms of a steroid injection or PRP. Some people, they don't like the idea of injecting steroid into their body. From my standpoint, I've had really, really good results with corticosteroid injections into the plantar fascial ligament. It's reduced inflammation and reduced swelling and reduced pain as a result, and allows my patients to get to Dr. Brian and the rest of the physical therapy teams a lot better, and their recovery is a lot quicker.
Yeah, 100%. It's a great way, especially when you have more of a chronic situation going on. Cortisone's a great way to kind of just get a lot of that inflammation out of there, sort of get you off that plateau, and allow us to kind of work through a lot more, strengthen a little bit more, build a little more stability throughout the foot, and not have it be so painful for you, and that in turn should lead to a better result. So a lot of times we go that route. It's always a combination of things, right? That's the goal, is to use multiple therapies to try to treat a body part or an injury. So doing the physical therapy in conjunction with something like cortisone injection, if you're not getting that result, can be a really powerful way to kind of break through or break that plateau, or kind of get past that. And there's other options as well. We have patients who don't maybe do as well with cortisone, or maybe they've let something linger for a year or 2 years at an end. And that's where something like PRP would come in handy, right?
Yeah, PRP is a great modality, and it's, it can be used for plantar fasciitis, but it can be used for a ton of other things. I inject it into the ankle joint, I inject it to the Achilles tendon, it's injected into the knees, shoulders. is injected all over the body. So when we're talking about plantar fasciitis, when we're talking about the PRP, so exactly what happens is we take blood from your body, we put it in this machine called a centrifuge, which spins it really, really fast, and we separate the white blood cells from the red blood cells. And those white blood cells are healing factors in our body. So we want to isolate that and be able to inject it into the area. So we inject a lot of healing factors into the area of the irritation and of the inflammation to help resolve the plantar fasciitis. And it typically does a great job. And it's for those people, like Brian said, you know, people who can't tolerate steroid or who just don't have a good history with steroid injections. So PRP is a definite option for plantar fascial patients.
Yeah, 100%. It's a great way to kickstart the healing cycle. So meaning that when you are in a chronic phase, meaning that this has been going on for longer than 3 to 6 months, it can kickstart it back into more of an inflammatory phase and create more healing in there, which allows us to get it rehabbed and get it feeling better. It's also a good way to not have to be down a ton, like surgery or something else may lead you, so you can be kind of on your feet fairly quickly afterwards, less invasive, just another option there. If that doesn't work, kind of what else would you go to?
So at that point, if we're talking physical therapy is not working, steroid injections are not working, we've tried PRP, then we would probably jump to something called a 10-jet procedure. A 10-jet procedure is a minimally invasive procedure where, luckily, the day of the procedure, you're on your feet, you're in a boot for 2 weeks, but you're on your feet. You're able to walk around, do your activities of daily life. You can go to work, you can do everything. And what it is a 1 millimeter incision. And we go in and we clean out that plantar fascial ligament. And the way that that's done is with a high pressure saline that is performed within the plantar fascial band. And that's called a tenotomy. So we've had really, really good results. I've done them not only on teachers and police officers, but I've done them on high level athletes, professional women's soccer player. I've done it on a D1 football player. So it's got great results. It's got great research behind it and has shown to really be effective.
Yeah, no, it's a newer procedure, and it really works very, very well for treating these patients. And the reason why we want to go through all these options is because I see people all the time who come in and they're like, I've had plantar fasciitis forever, and they kind of throw their hands up because maybe therapy didn't work, and they don't want to do surgery, and they don't realize there's 3 or 4 steps between having a true full surgery and actually just trying physical therapy when it comes to something like plantar fasciitis. So those of you out there suffering from it, there are options out there that aren't super invasive, aren't going to leave you in a boot for 8 weeks, but also can be very, very helpful in resolving plantar fasciitis. You don't have to live with it,
Yeah.
So, definitely.
So what are some things people can do, before they even get to these steps? I mean, obviously, stay off your feet. Stop working so hard. But other things people can do at home, like or in the middle of the day, just to kind of stretch out their feet and get some relief?
Yeah, absolutely. So definitely the best form of stopping plantar fasciitis is prevention of it. So trying to get ahead of that. Doc was talking earlier about how the calf muscles are very well attached to the same bone where the plantar fascia attaches into. So you want to make sure you're keeping your calves stretched out, especially if you're on your feet all the time. If you wear heels often at work, that kind of thing, you really want to work on calf stretching, dedicating at least some time of your morning or some time of your evening to that. If you are a person who usually goes to work for 8 to 10 hours, stands on their feet, and then goes straight to the gym and works out, you really want to have a good lower body stretching routine to prevent that. And then you just want to work on general foot health, working on strengthening the muscles in your foot, working on strengthening kind of all the intrinsic foot muscles and stabilizing them, working on building a little bit more of your arch. And there's a lot of ways to do that. If anybody has any questions, feel free to DM us. I'm happy to send you guys exercises. You could also take a tennis ball, golf ball, if you're starting to feel that kind of thing, and roll it on the bottom of your foot, kind of from the ball of your foot down to the heel. That's going to be a nice way to kind of release that plantar fascia as well.
I'm just going to interject right there. What I actually like, so I like that, but what I like even more is if you take a frozen water bottle.
Yes, yeah, that's the way to do it.
A frozen water bottle is really, really effective in terms of reducing the amount of inflammation because it's ice as well as that cylindrical cone kind of feel to it that you can run your arch over and really stretch the plantar fascial band out. So you're kind of getting 2 modalities in one with that.
Yeah, no, it's a great call. Absolutely. That's really the top-notch way to hit it, and to do that after you're maybe on your feet for a while, or after you're, did a workout, or after you ran, or after you just were feeling that pain. That's a great, great way to do that. And honestly, too, like Doc said earlier, orthotics. Orthotics are huge because if you get good ones that are quality for you, they're going to create more cushion. So if you're on your feet for 8 or 10 hours a day, you need every bit of support you're going to be able to get. And something like that is going to help support that arch and make you feel a lot better while you're standing. So.
And I think I think there's a lot of reservation with people with orthotics because they think about orthotics and then they think about grandma's orthotics, which were hard as metal, right? And like you could throw it against the window and it'll break through it.
Yeah.
That's not the orthotics anymore. That's not what the orthotics are made of anymore. You know, they're made of this nice soft top cover. It's got a suede bottom cover, and it's got this hard plastic in between. Ed, it's a suede bottom cover. Yeah, it's high level stuff.
Good stuff, guys.
Suede, man.
Suede. So, you know, it's really, like I said, it's really high quality material. It's comfortable. It's airy. They're lightweight. They're not that leathery material that you'll see at other doctors' offices. They're made for athletes and people who are on their feet.
Yeah.
What about, like, I mean, then you run into the question, like, okay, people see these Dr. Scholl's kiosks in, like, a Target or a Walmart. What's the difference between buying something like that and coming to you for a custom orthotic?
There's a massive difference, right? You know, one patient told me that those orthotics are made for everyone else, so that means that they're not made for me. And I think that's the perfect way of kind of putting it, is that, you know, just because everyone else or 90% of the population or, you know, has a specific foot type, doesn't matter percentage, right? Doesn't mean that orthotic is going to fit with everyone's foot. These are 3D scanned, meaning it's exact, precise to the nth degree type of orthotic, and the arch and all the support that comes with it is custom for your foot, as opposed to this generic one where you pull it off the shelf.
Yeah, because I've seen the video of you on your Instagram. You have like it looks like an iPad, but like that you're like scanning the foot with it correctly.
It's an iPad with a 3D scanner actually attached to it.
Yeah, so I mean they're coming in and getting their exact foot.
It's their exact foot.
Exactly. Yeah. Whereas otherwise you're picking from maybe 5 to 8 different variations of an orthotic, which doesn't really make a lot of sense.
And they're making it all. The company we send it to actually has a 3D printer that they print out a 3D version of that foot, and that's how they base the cast of the orthotic. So that's how we know it's super precise.
That's awesome. And besides plantar fasciitis, we got a little list over here. What are some other things that people who are on their feet all day can expect to experience? Let's see, we've got heel spurs, Achilles tendonitis. Can we speak to any of those?
Yeah, I mean, heel spurs are a direct cause of plantar fasciitis, right? So, typically they come hand in hand, and it's a common misconception that you're getting pain from a heel spur. That's actually not causing you the pain. You can leave the heel spur there forever on the bottom of your foot. That's not going to cause you pain, but it's the inflammation surrounding it. It's the tight plantar fascial band surrounding it. So once you get that inflammation down, that heel spur will be there, but that doesn't necessarily mean it's going to cause you pain.
Yeah, absolutely. Yeah, it's like a root to it sometimes because it could be causing compression, but overall it's really not like the main issue there for sure. Achilles tendonitis, I heard you mention, that's definitely another thing we see a lot of when people are on their feet for long periods of time. Yeah. And this kind of goes back to what we were talking about, right? Everything's kind of sitting in that calcaneus, which is the heel bone of your foot. So your plantar fascia is attaching underneath, your Achilles is attaching from the back. And when you're on your feet a ton, those Achilles tend to start to shorten up because the muscles get tighter, and then you start to put a lot of pressure on them, and that can create inflammation in that area, which leads to your Achilles tendonitis. Very similar, prehab-wise, so to prevent it, you want to do a lot of calf stretching, you want to work on strengthening them, you want to wear proper footwear. If you start to have that pain, we can kind of go through some different ways we manage that as well, from different like heel cups, that kind of stuff.
With Achilles tendonitis, lifting that heel and taking the pressure off of it is a huge factor in all this. A lot of times people, again, with Achilles tendonitis, it's funny because I was playing basketball on Saturday, and
has he seen the block footage yet?
Oh, you have not.
I've seen it.
I'm gonna upload it to my Instagram. My friend's gonna be mad at me, but it's all right. He claims he was fouled by another guy, but
we can blur out his face.
Definitely,
that's fine. Sure. Yeah. So I developed a little bit of tenderness and swelling in my Achilles, and I've been getting physical therapy for it. But it's so common. I mean. Actually, Mike Zola was helping me.
Oh my God, Mike Zola! No, I'm kidding. I'm just kidding. We love Mike Zola.
Yeah. So, I was getting work. I was getting Graston done. I was doing stretching exercises, taping, strapping.
Yes.
The heel cup to elevate my heel so that my Achilles isn't under a lot of pressure, and you're probably wondering, well, why are you giving me a heel cup? What does that make any sense? How does that make any sense? And really, when your foot is in a 90-degree angle, do you have that foot?
I do.
Awesome.
We have a
Here's
foot.
a foot for you.
So when your foot is in this 90-degree angle, the Achilles tendon is here, and it's attaching to the top portion of your foot. And really what happens is that the Achilles tendon gets put under a tremendous load of stress as a result. Mm-hmm. So if it's in this flat position, or when it lifts up in a dorsiflex position, when you're every step that you take, that pulls on the Achilles tendon and really causes this inflammatory reaction. Mm-hmm. Now, if we're able to give a little bit of a lift underneath it, we're able to really take the tension off of the Achilles tendon, and that really helps it to give it time to heal. So again, early intervention, I was playing on Saturday morning, I was in physical therapy on Monday. So I don't want to have to be put in a boot because I didn't take a look at this 6 months, for 6 months. So, that's the key here is early intervention with anything that we do.
Definitely. And Achilles tendonitis, actually, early intervention is very key, because if you let that linger, again, you're going to cause irritation of the tendon. You're eventually going to cause the tendon to degrade, and that leads to what we have, like an Achilles tendon rupture. And I've seen that many times where somebody's playing sports and they're like, I used to have some Achilles pain, but I just work through it every time. It's no big deal. It feels a little better as I'm running, and it's worse afterwards. And then suddenly they go out and they jump or land or do something and end up rupturing their Achilles, and that's a major injury that will definitely sidetrack your athletic career, but also will leave you, laid up for 8 to 10 months really at the end of the day before you're fully recovered. So it's a very tough one, and it's something you want to avoid, and that's why we tell people, like, get in. If you feel something, take care of it pretty immediately. Doc talked about strapping. I think that's a great thing to talk about that we didn't really mention in the plantar fasciitis. So what does that mean, really?
Yeah, taping, strapping is super important with Achilles tendonitis. It really gives that level of support for the Achilles tendon. Again, we're talking about taking tension off, taking stress off the Achilles tendon and any tendon when we're taping it. And it's proven and shown to really help with the inflammatory process and reducing inflammation, because again, we're reducing the amount of tension on the tendon itself.
Yeah, and that's the key. Is the idea behind the heel cups or an orthotic or taping or strapping is we're just trying to take the tension off of where that tendon is, because there's a ton of tension on it. It's one of the most high tension tendons in your body, and we're trying to just take that pressure off for a period of time to allow the healing process to occur, to allow it not to continue to get irritated. That's going to make sure the inflammation or the swelling or inflammation that's sitting there gets out of there, and you start to feel better. We could also do this through exercise. So we do stretching. We do what we call eccentric exercises, which is kind of a way to sort of load the tendon and lengthen it at the same time. And it's proven to kind of break up a lot of tendinitis, tendinosis that could occur in there. And we also just work on some strengthening after the fact to make sure that this doesn't keep happening to people when they're runners, when they're basketball players. When you do anything plyometric, jumping, running, anything like that, that's going to kind of put you at risk for this sort of thing.
Yeah, and the TENJET procedure that we talked about in regards to the plantar fasciitis can also be used twofold with Achilles tendinosis, meaning long-term Achilles tendonitis. So people who have gone through the physical therapy, have gone through all these, the heel cups, the strapping, the taping, all of those conservative modalities, and because unfortunately they've waited too long to address this, then we talk about minimally invasive surgical procedures that, again, with the TENJET procedure, we're going in and cleaning out that tendon, cleaning out the thickness, the scar tissue.
Thing,
Yeah, it's exactly what
Close it down, put it back.
Exactly.
That's a way of looking at it.
Yeah, you're basically just power washing all the inflammation out of there. No big deal. But
because what happens is that the scar tissue really starts to develop over the course of 6 months to a year, and it really starts to reduce the amount of fluidness and fluidity that the Achilles tendon is able to glide in its sheath. So when it does that and it doesn't have the ability to glide in the appropriate manner, we have to get rid of that somehow.
Yeah, definitely. I think a good sidetrack to that, because this is something I see a lot, and people come in, they don't really know what it is how about talk about you get an enlarged bump, like a Haglund's deformity going on in the back. So this is something that comes along with Achilles tendonitis a lot?
Yeah, so just like that spur on the bottom of your foot with plantar fasciitis, this is a little bit different, but it's similar in the sense that it's being caused by the long-standing Achilles tendon and the tightness of the Achilles tendon. So, everything, we say in medicine, everything comes in waves. So recently I've had about 3 of these patients who've had long-standing Achilles tendinosis, long-standing Haglund's deformity, which is that bump, and a lot of women get it. They call it a pump bump. as a result of wearing their pumps.
Yeah.
Right.
Standing in
So
those
high
shoes for long
heels.
periods of time?
Yes.
Yep.
Okay.
Standing in those shoes for years on end, and it's catching up to them. And they get this really large red bump on the back of their heel. So it would be right here, sitting over the skin right there, and causing a lot of pain. And sometimes a spur can form in that area, and that spur can cause pain within the Achilles tendon itself. And as a result, it does require, unfortunately, pretty large surgery if it gets to the point where it's intolerable.
Yeah.
So if it's intolerable and you're unable to do that, we try to get you better with conservative therapy, and a lot of times that works.
Yeah.
But
absolutely.
sometimes it doesn't, and it results in surgical intervention of us getting rid of that bone spur.
Definitely, yeah, exactly. And that's really it. It's basically like a bone spur. It's going to cause pressure on that Achilles tendon. And just like before when we talked about the plantar fascia, once you cause that pressure and you create that inflammation, it's very difficult, especially when it's that large, when it gets very large, enlarged and painful there, for you to really like break that up conservatively. So you really want to, again, try to take care of these things early on. I mean, that's going to be the name of the game for any injury, is you really want to be kind of out ahead of it as much as possible.
Yeah.
So, definitely.
Stop wearing high heels. Would you
Yeah.
say?
I mean, everything's in moderation,
Yeah.
right? We can't tell everyone to stop wearing high heels or to stop standing on their feet, but as long as you're doing things in moderation, and you can wear
Yeah.
heels every now and then, and but
Well, and
you
that's
can't
it.
wear it every day.
Yeah, and if you do wear them every day, like you should work on stretching. You have to understand that that's fine, but you're putting your calf in a very shortened position for 8 to 10 hours a day, which means that you have to work on lengthening that calf muscle as well. Otherwise, you're going to just create massive imbalance in there.
Sure.
So, absolutely.
Yep.
Cool. If anybody watching has any questions right now, if you want to ask the doc, we're just about out of time. About 3 minutes or 8
You talk
o'clock.
about Nantucket otherwise.
So what'd you do in Nantucket?
Yeah, right, so what happened here?
Just watch sailboats.
Yeah, just
drift
drift
by.
by. Drift by. It's not bad.
You
It's not
know.
bad life. It's
It wasn't terrible.
no,
I can't
it's a
lie.
nice little spot.
Yeah.
I've been to Martha's Vineyard, not Nantucket.
Never
so
been there.
it's-
I didn't realize how far out Nantucket was.
Yeah, you're out there.
I didn't realize how far.
That's
I
it.
mean, it was pretty far out.
Yeah, it's a haul for sure.
Yeah.
But good spot.
Bill
Yeah.
Morgan wants to know when our 2-on-2 charity basketball tournament.
Oh, now we're talking. You must have saw the block footage. Listen, the only way we're having a 2-on-2 charity basketball is this guy's my partner. That's it. So sorry, you guys are.
Let's
beat.
do it.
His team right here will take care of business. All right, Bill.
They don't want a piece of us.
No, not at all.
No, I've seen the block footage. We got to put that on
Yeah,
Instagram.
that's exactly.
I mean,
it.
I was at least 3 inches off the ground.
Yeah, I mean that's not.
Thanks to a steady regimen of stretching.
Yeah, it's
That's
exactly
right.
plyometric
That's
work.
right.
I mean, it's hard to stay in the shape, guys.
Yeah.
I love how you said you immediately came for physical therapy Monday. You were like, ah.
Yeah, no, I don't mess around with that stuff.
No, for sure. Yeah, and that's the move, because once you start feeling it, a lot of times the natural reaction is to be like, it's gonna go away. I'll walk it off.
Yeah,
I'll
I'll
play
put
it
some
off.
ice on it.
Yeah, and it just
I
ends up
started
nagging.
stretching at home right away.
Yeah.
Like, I literally went home that same day, and I started stretching.
Yeah.
Stretching after you play.
Right.
Like, I think a lot of people don't realize that people think they stretch to get warmed up,
Yeah.
and afterwards they just sit and relax.
No, you can't just hop into a car and drive home.
No.
Not at this age. At
No,
least.
that's it. Yeah, maybe when you're like 16, but
Yeah.
at this age it doesn't really work so
Yeah.
well. Yeah, no, you definitely want to stretch afterwards, especially if you're playing, rec league ball like ourselves over here these
Yeah.
days.
trying
So,
to live vicariously through our
yeah,
younger selves.
exactly. It's unfortunate, but this is what happens.
Looks like we don't have our very own Renee jumping in with all the questions. so I
No,
guess
that's
I'll-
all good.
All right.
I'll wrap it up here. It's me again. Thank you guys so much. We're going to do this
Yeah, thanks
every
for
other
having
week,
us.
correct?
Absolutely.
Yeah, sounds like a
Man.
plan.
Jump in with how often can we talk about feet? Every
it.
2 weeks. Next week we're going to have Dr. Alok Sharan. He's going to be here to talk about a topic related to neck and back issues. And we're going to have a special guest with him. I think we're still planning that out. Make sure you follow these guys on Instagram. Dr. Amar _NJSW.
There it is.
That's it.
Bryant _NJSW. You can find them on the NJ Spine Instagram. We're constantly sharing their content, especially this guy. We got a lot of videos in the works.
Awesome.
That's it.
Thank you guys for watching. Make sure you follow NJ Spine and Wellness on Instagram, Facebook. Check out our YouTube channel. We're going to have a lot of videos, also physical therapy, foot and ankle, everything. And we'll see you two in 2 weeks.
Sounds good.
Awesome. Sounds good. Bye, guys.
Thanks for
Take
watching.
care, guys.
Take care, everybody.